We count on them during our worst moments, but many of us don't realize the constant threat faced by healthcare workers. Savage attacks from the very people they are trying to help. Tonight, Lisa Fletcher reports on why more hasn't been done to protect caregivers.
Patients in emergency room triage are at their most vulnerable.
This is the room where I was assaulted.
But it is doctors and nurses across the country who are increasingly finding themselves defenseless to violent attacks in those safe spaces.
She basically stood up, punched me, and I did fall off my chair into this desk here.
Beaten and bruised, Maryland nurse Lisa Fletcher was left with a black eye and 3 stitches.
You must have been so shocked and disoriented.
Totally shocked. I had no idea it was coming.
I've tried to get help.
But those unpredictable attacks are happening more often than you might think.
It is definitely on the rise. And it's not just here, it's not just my county or Maryland, it's nationwide.
Where is the injured nurse? The nurse is in the floor.
This Florida nurse was nearly beaten to death by a patient. This Pennsylvania gunman used nurses as human shields. And these are the faces of doctors recently murdered at work in Oklahoma and Tennessee. And it's getting worse. In 2015, a survey found 47% of emergency room doctors and 1 in 4 nurses reported being physically assaulted at work. 10 years later, a staggering 91% of ER doctors and 80% of nurses report violence on the job.
I can say, just in hospitals that I'm aware of, we've had, more than 6 incidents. Several nurses have been hospitalized. Several nurses have not been able to come back to work or have had permanent impairments. And that's just really in the last 2 or 3 years.
Only a dozen states have laws requiring healthcare employers create workplace violence prevention plans. Just this month, Virginia joined that list, requiring hospitals to create a system to document and track violence. There have been attempts at the federal level to protect healthcare workers, but none has become law.
When you look closely, this has become a real national crisis, really.
Maryland's U.S. Senator Chris Van Hollen is co-sponsoring a bill that requires healthcare employers to create a violence prevention plan.
In 2021, a similar bill had 145 co-sponsors. In 2023, a similar bill had more than 170 co-sponsors, yet both times it got derailed. Where do you think the hiccup is?
Well, there's some folks that just don't like the idea ever of putting in place sort of workplace safety regulations. They prefer sort of a free-for-all environment. I think that's a mistake.
Who needs to buck up, and who's been preventing action up until now?
Well, we'll see. We've introduced this piece of legislation. We hope to get it over the finish line. We unfortunately, do not have, strong bipartisan support at this moment.
All right, I'm just going to put this on your arm.
Nurse Lisa Fletcher says she's doing her job.
We're almost there, almost done.
It's time for Congress to do theirs.
We are here to help people. We are nurses that get into these unpredictable situations that are sometimes, out of our control. But being assaulted is not part of our job.
For Spotlight on America, I'm Lisa Fletcher.
Senator Van Hollen stresses the importance of constituents calling and expressing their support of action to protect healthcare workers. To find out how to contact your member of Congress, you can go to spotlightinvestigates.com.